Hello and welcome to Focus Ultrasound Foundation DIPG Clinical and Preclinical Symposium. It is our honor to present an overview of some of the work has been done in the context of diffuse midline gliomas and diffuse intrinsic pontine gliomas with my colleague, Dr. Ozdas, who joins us from Switzerland. Pediatric brain tumors are, a glimpse of the pediatric brain tumors is shown here in the context of the mutations that they have. The particular tumor that we are studying here are K27M mutant. As you can see, these are typically young children. The anatomical location of these tumors is midline structure that is affecting the brain of these children. There are, of course, different mutations within patient's population that may manifest into the cortex or various anatomical location within the brain. As I mentioned to you, DIPGs or diffuse midline gliomas are the tumors that we are discussing today in this session. And as you can see here radiographically, this is a tumor that has formed in the pons of the patient. DMGs are about 1,000 cases in the US and Europe. The age of the onset is between the ages of 5 to 9. It is a very deadly cancer. 99% of patients who are diagnosed die within 9 to 10 months of their diagnosis. One of the major causes of this tumor is the penetration into the blood-brain barrier, of course, but also penetration of therapeutics into the brain parenchyma. You can also appreciate that these cells are highly infiltrative. You can find the cells post metastasis into the midbrain, thalamus, and other areas of the brain. And of course, some of the studies that we show here have been done at postmortem, where you can find tumor cells in various anatomical locations. This brings up the opportunity that focused ultrasound could perhaps provide to not only open the blood-brain barrier, but also reach the tumor cells within the brain parenchyma with sparing the healthy cells. We have shown this study at autopsy. We have cut through the pons and cerebellum, as you can see here in panels B and C, or throughout the brain. And then we have studied how does the tumor change. What is interesting here to show this is the pons of the patients that has been studied, is that when the tumor migrates north or towards the spine, the tumor environment, but also the tumor biology is changing. You can appreciate this from both histology, but also some of the single nucleotide variants that are changing within different tumor anatomical location. Again, this emphasizes that we need to reach out the tumor regardless of its location, but perhaps we also need to have a precision method where we would be targeting tumor cells in the context of their particular mutation.
So I will be summarizing some of the work that has been done within the DIPG context. And the first study is from 2018 by a group in Toronto, James Rutka's group. This study was done just in a healthy animal, in the rats, and just to show the feasibility of BBB opening and the safety in the brainstem. So they verified that the brainstem can be opened, and they verified this with Evans blue staining, and then they tested physiology of the animal, such as heart rate and respiratory rate before and after focused ultrasound application, and they did not see any negative effect in this physiological studies. And then they also did two behavioral studies, and these were rotor test and grip test. In both cases, the animal did not see any negative impact on their performance. Only in the grip test, the ability of the animal to grip has increased slightly, or their power has increased slightly. And this is, according to author, can be attributed that animals were more trained actually post-FUS application. And they also did a histology study, and this was to measure whether there was any vacuous in the brain, or there was any cell death or hemorrhage post-focus ultrasound application. But they did not observe any of these after ultrasound application. And then they also wanted to measure how much ultrasound has increased the drug uptake in the brainstem and other brain areas which are not treated normally. So the cerebellum has slight effects because it is also on the way of the beam when you try to target brainstem, but the brainstem by far has the most concentration compared to any other brain regions. So this was all very positive. And then the authors went on testing this study on a DIPG model, actually, with not-sit gamma mice. And they verified the opening in with MRI and evidence flu staining. And then they tested doxorubicin post-ultrasound application in the tumor area. And this was, again, verifying that 3-4 times doxorubicin concentration has actually increased. But this, unfortunately, did not translate to survival ratio increase in the animal. So there was another study just recently also published by a group in New York. And this study as well was very similar, but they tested a different drug, etoposide, instead of doxorubicin. And they similarly measured 3-4 times higher drug concentration in the tumor area. And the body weight and the survival ratio of the animal as well in the study did not really change. And so here in Switzerland, with Gerard, we have been doing some in vitro studies. So our concept was basically we take some biopsies from patients, we grow them as cultures in the well plates, and then we take them our high-throughput focused ultrasound system and we treat them with drugs and ultrasound sequences to selectively eliminate these cells. So this is our actual focused ultrasound system. And now you'll see a video about it. So here what you see is first the gassing unit. Here we are measuring basically oxygen level inside the water tank. It shows 1.8 milligram per liter. And then we are keeping the temperature stable at 37 degrees. And here we keep our DIPG cells in the 96 well plates with all controls. And we have our focused ultrasound transducer guided with the 3D system in our setup. And you see now the focused ultrasound transducer is perfect at the bottom and truncating from the bottom of the vents. So to conclude, FUS, focused ultrasound research for the DIPG, is at a very early stage. And the drug concentration increase in these two studies did not really translate to survival ratio increase in the animals. Is this because unique DIPG microenvironment, or because these particular drugs were not effective enough, or their concentration was not high enough? We don't really know. I'm hoping some of these authors will be in the workshop, and I'm hoping they will explain it. And the advanced in vitro models can also be promising tools for screening novel solutions to agents. Thank you so much.